Hi everybody, welcome to week 7 of your nursing practicum course. This week we are focusing on competency 4, curriculum design and evaluation of program outcomes. So I believe that in your Seminar 1 and Seminar 2 courses that you got a little bit of a taste for this when you had to develop a short class, right? You had to develop the objectives and the content and the evaluation methods and that sort of thing. So you've got a little bit of exposure. I love curriculum development. There's a wide variety of things from developing a small online continuing ed piece to creating the content for a nurse residency program to developing a whole new course at a college or university to actually starting a brand new nursing program or something like that. So wide range of possibilities. So if you remember from previous courses, everything needs to tie together. So starting with the mission and vision, the overarching goals and student outcomes, then down to maybe the class or the unit level. So everything needs to be kind of built on one another, and they all have to tie together up and down that hierarchy. Most new educators start kind of dabbling in this area with curriculum revision. This can be a challenge in itself. There's many areas to examine with curriculum revision. New accreditation requirements, new knowledge in the field, new emphasis for the nurses at the bedside. I mean, there's just a lot of things to look at when you're revising curriculum, as well as how does your continuing ed piece, class, course, whatever, tie into everything else. For instance, sometimes in nursing programs, we'll go through the curriculum and see what things might be duplicated. Like for instance, DIC. DIC might be advanced med surg, critical care, OB. It could be discussed multiple places. So you kind of have to know what is also being taught to your learners in other areas when you're looking at what you want to teach to them just from your perspective. So if you ever have an opportunity to be part of a formal curriculum like revision process or something like that, it would be really beneficial. It's just so interesting, all the things that you need to consider. So when we're talking about developing curriculum, we also need to think about types of curriculum. So there are many different kinds. I'm going to attach a little chart that talks about just some of the types of curriculum. And like for instance, there's maybe the taught curriculum and the null curriculum, what you actually teach and what you decide not to teach. So making that differentiation between what I'm going to include and what I'm going to exclude is actually a really big curricular decision with the different types of curriculum that you need to consider. So I'm going to do that. And then this week, let's see, this week, we have an assignment this week, right? The midterm evaluation. So if you've completed at least 75 hours within your practicum, then I would like your preceptor to complete your evaluation, for you to discuss it, and to submit it this week. So your preceptor is supposed to email it to me, tracy.hardell@my.gcu.edu. And that's more for like a confirmation thing about what you submit and what they submit. Anyway, then you're supposed to upload the document to the assignment area, right? And if you upload it with just your preceptor typing in their name and their information on the computer and just upload it as a Word document, then I can actually sign off on that also. But if your preceptor has already manually signed his or her signature, then you'll have to scan it and upload it as a PDF. But for the final evaluation at the end, don't do any uploading of PDFs because I really do need to sign off on all of them, upload it as a Word document. Okay, so what if you haven't completed 75 hours in your practicum yet? Well, if your preceptor feels comfortable evaluating you now, great, go for it. But if they'd like to wait until you're at least halfway through, that is just fine. It won't be marked as a late assignment or anything like that. Just send me a quick note in your individual forum. Let me know you haven't gotten to the 70 hours and you're going to wait a little bit for your instructor to do that midterm eval, maybe another week or two. No big deal, no huge rush. I'd rather have it be accurate than have it be submitted this week. Okay, all right. I do have a class question for you for this week, something a little different. So, class question. You are the educator, the nurse educator for a medical surgical unit in a community-based acute care hospital. Okay, not like a major trauma center, just a community hospital. There's a surgeon who wants to start a bariatric surgery program at your hospital. Okay, you've been tasked with developing some sort of education to train the staff nurses and the aides about how to care for this new type of patient, because their care can be quite a bit different than your typical post-op surgical patient. What resources might you consult when you're considering developing this curriculum? So it's kind of a little bit of a challenge to broaden your horizons on what do we use, what do we need to bring in, what do we need to consider when we're going to develop curriculum. All right, guys, I'm going to be reading your NEPDs that you just submitted. Looking forward to hearing about how the practicums are going, and I will see you in the main forum.